We've reached a quorum, so we will begin. Participants will probably continue to connect in on the web and on the phone over the next few minutes. But since we have a lot of material to cover, and so that we can let you folks get back to the good work you are doing in the healthcare community, we'll go ahead and get started. Good afternoon. Welcome to Patient and Family-Centered Care, Partnerships for Quality and Safety, a web-based training presented by HealthTech DL and the statewide AHEC Program Office. We're glad that you could join us today. I'm the moderator, Teresa Rachels. I'm going to give a quick overview of HealthTech DL and also walk you through some housekeeping rules. Then I will turn over to our featured presenters, Pat Sadomka and Nettie Ingalls, whom I will introduce in a moment. We are presenting today from Augusta at the statewide AHEC Program Office. HealthTech DL is a collaboration of 10 organizations: Healthcare Georgia Foundation, Georgia's 6 area health education centers and the program office, a technology partner, TechBridge, and a communications and marketing partner, Avatar Communications. This collaborative will provide 40 formal capacity building programs provided by nonprofit health organizations statewide. In addition, the AHEC network will utilize HealthTech DL to support their mission and ongoing efforts with the healthcare workforce. For more information on upcoming presentations, please go to www.healthtechdl.org. A few housekeeping items. If you're having trouble with the seminar software, check to see if Flash Player is enabled and if you have any pop-up blockers disabled. If you can connect to the seminar and the audio portion but get kicked off at any time, just reconnect using the instructions that were provided in your email invitation. Background noise is a big problem on these types of conferences, so please use your mute button on your phone to make sure that the rest of the audience cannot hear any sirens or conversations or cell phone ringers in the background. If you don't have a mute button, you can mute your phone by pressing *6. To unmute, press *6 again. If you have any technical issues, please contact tech support at 404-969-0387 or email support@healthtechdl.org. This activity has been planned and implemented in accordance with the essential areas and policies of the Accreditation Council for Continuing Medical Education through the joint sponsorship of the Medical College of Georgia School of Medicine and the Georgia Statewide AHEC. The Medical College of Georgia School of Medicine is accredited by the ACCME to provide continuing medical education for physicians. The Medical College of Georgia School of Medicine designates this educational activity for a maximum of 1 AMA PRA Category 1 credits. Physicians should only claim credit commensurate with the extent of their participation in the activity. The following planners do not have anything to disclose: Dara Balance, Carol Cassell, Denise Cornegay, and Norma Robinson. Pat Sadomka has disclosed a relationship with the following company. She is a faculty for the Institute of Family-Centered Care and has received honorarium. With that, I will go ahead and introduce our featured speakers. Pat Sadomka is Senior Vice President of Patient and Family-Centered Care at MCG Health, Inc., and Director of the Center for Patient and Family-Centered Care at the Medical College of Georgia. Nettie Ingalls is a Patient Advisor at MCG Health, Inc., a Family Faculty Member, and a Cancer Center Patient Advisor. Ms. Sadomka and Ms. Ingalls.
Well, good afternoon. It is a real pleasure to be here today with our statewide audience and to take a few minutes to talk to you about patient and family-centered care and the collaboration that can exist between providers of all kinds, whether they're doctors, nurses, allied health professionals, administrators, consultants, architects, planners, you name it, and patients and families. And what I'd like to do is spend just a few minutes talking about our what we would like to cover today. First of all, we want to develop a shared understanding of what is patient and family-centered care. We're going to give you some practical strategies for how you can begin to develop partnerships with patients and families in the healthcare organization that you are a part of. And we're going to explore just a little bit what that means in terms of strengthening quality and safety. And also we'll share with you some of the outcomes that we have seen here at the Medical College of Georgia in Augusta since we began working on patient and family-centered care and partnerships in 1993. I'm very honored to have with me Nettie Engels, one of our lead patient advisors, and she will also be helping you to see what the work looks like from the perspective of our patient and family advisors. So what is patient and family-centered care? One of the things that I think is so important to understand is that patient and family-centered care is really about developing mutually beneficial alliances between patients, families, and caregivers. And that is such an important thing to understand. This isn't a kind of care where just patients and families benefit or a kind of care where just healthcare providers benefit. It is a kind of care where everyone in the healthcare system has something better that comes out of it. And the fundamental principles of patient and family-centered care are one of the things we want to leave you with as you're thinking about transforming the kind of care in your healthcare system, whether it's a small clinic, an ambulatory practice, a hospital setting, a long-term care facility. These principles apply, and here they are. There are 4 of them. The first is people are treated with respect and dignity. Now, you would think in today's world we wouldn't have to talk about that, but we know that we do. We know that too many times patients and families come into a system, they may not feel welcomed. They may not be, their healthcare providers may not do something as simple as introduce themselves. They may be trying to provide information to healthcare providers and not be listened to fully, and therefore parts of the important information they have to share aren't absorbed by their healthcare providers. So everything begins with respect and dignity. Healthcare providers communicate and share complete and unbiased information with patients and families in ways that are affirming and useful. Very important. This is the era of transparency in healthcare. That means sharing things, explaining things, doing it in a way that to the degree a person wants to know and understand what is happening, they have all that information, and it's shared with them in ways that they can understand. That means getting rid of the jargon that we like to use in healthcare that so many of us, we understand if we're healthcare providers, but our patients and families don't. And particularly doing things in ways that people really can use the information. Not everybody's the same. My almost 28-year-old daughter who is expecting my 4th grandchild in October, she is extremely knowledgeable, has had 3 natural childbirth experiences, and I expect she'll have a 4th. And she has a real strong partnership with her obstetrical providers, and really there's just a tremendous amount of give and take in terms of the information there. My 90-year-old father-in-law, on the other hand, Joe, you know, he needs Dennis and I, my husband and I, with him all the time in his healthcare experiences, and he is not likely to ask for a lot of questions, so we help him with that. So you have to bend and flex to what the individual needs. Individuals and families build on their strengths through their partnership and through participation in experiences that enhance control and independence. I happen to be a breast cancer patient, and having